Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is curative care? Curative care is treatment aimed at curing the patient of their illness. Curative care differs from palliative or hospice care, which are not intended to cure but rather to relieve pain and keep the patient comfortable. /r/n/r/n For example, curative care for breast cancer includes any treatments that remove or destroy cancer cells with the ultimate goal of eliminating all evidence of disease. Palliative care for breast cancer may be given when other treatments fail to eliminate the disease and the goal becomes symptom relief. /r/n/r/n This article discusses curative care, when it is used, and how it differs from other types of medical care. /r/n/r/n Curative care is used when healthcare providers believe it is possible to cure a medical condition. Early-stage cancer is an example of a condition that will usually be treated with curative techniques such as medication or surgery. /r/n/r/n In some cases, curative care may have significant side effects. These side effects are often considered acceptable because there is a real possibility of a cure. /r/n/r/n In some situations, there is no obvious correct choice. For example, sometimes a cure is possible but unlikely, and the side effects of the curative therapy may be too intolerable to justify trying to cure the disease when the chances of success are remote. /r/n/r/n When there doesn't seem to be a possibility that a person will recover or be able to sustain a reasonably normal quality of life, their healthcare team may suggest ending curative care. This is always done with the patient's best interests in mind. When curative care is no longer effective, it can unnecessarily contribute to a poor quality of life. /r/n/r/n For some patients and families, the decision to end curative care is a relief. For others, the idea of giving up on a cure is upsetting or frightening. Many hospitals offer counseling and support to help families make the decision to end curative care. /r/n/r/n Depending on your condition, there may be more than one type of curative care available to you. For example, a person with breast cancer may undergo surgery to remove the tumor followed by radiation treatment or chemotherapy to help ensure that all cancer cells have been eliminated. /r/n/r/n Curative care is aimed at eliminating a disease or medical condition and restoring the patient's overall health. Depending on the medical condition, there are a number of different types of curative treatments that can be used to achieve this goal. /r/n/r/n Medications can be given to help eliminate a disease or condition. For example, a course of antibiotics may be given to eliminate a bacterial infection such as strep throat or a urinary tract infection. Antiviral medications can help cure severe cases of COVID-19. Chemotherapy drugs are given to help eliminate certain cancers. /r/n/r/n Some conditions can be cured with surgery. Appendicitis is one example of a medical condition that can be completely cured with surgery. Surgery may also be used to remove early-stage cancer or benign tumors like uterine fibroids. Surgery can also help cure internal injuries sustained during a traumatic accident. /r/n/r/n Casts and braces are medical devices that set broken bones and aid in proper healing. Even though this type of injury may not be life-threatening, these devices are considered curative because they restore normal function after a serious injury. /r/n/r/n Many other types of therapies and treatments can also be considered curative. For example, /r/n/r/n Curative therapies may be given at home, in a hospital, or in an outpatient facility such as a physical therapy or dialysis center. /r/n/r/n The term curative care is often used in contrast with palliative care, which is a treatment or therapy that does not directly aim to cure a patient. Instead, palliative care aims to provide comfort for the patient in the moment, through minimization of pain or other illness-related issues. /r/n/r/n Palliative care is a specialized form of healthcare that aims to reduce suffering and improve the overall quality of life of patients and the families of patients who are faced with life-threatening illnesses and medical issues. /r/n/r/n Depending on your condition, you may be able to receive more than one type of care simultaneously. For example, you can receive palliative care at any point during cancer treatment, even shortly after diagnosis, while you are also receiving curative care. /r/n/r/n Hospice is a specific type of palliative care that is provided to individuals in the last 6 months of life. While palliative care can be used in patients who are still being treated curatively, hospice care is generally reserved for those with a terminal diagnosis or those who have decided that the side effects of curative treatment outweigh the benefits. /r/n/r/n If your insurance covers palliative care, they may not cover curative care for the same diagnosis. However, you will still be able to get curative care for other medical problems. For example, if you are receiving palliative care for cancer and you fall and break a bone, you will still be able to receive curative care for the break. /r/n/r/n Curative care is a type of medical care that aims to cure a person of a disease or medical condition. The goal of curative care is to eliminate the disease and restore the person to a state of good health and normal quality of life. /r/n/r/n Curative care can come in many different forms, including medication such as antibiotics or chemotherapy, surgery, or other medical procedures such as radiation or dialysis. Curative care differs from palliative care, which is a type of care that aims to reduce pain and other symptoms but does not have the goal of curing a condition. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.